Rehabilitation and Skilled Nursing Center has a unique population they're serving. They're doing some unique therapies. Amanda and Haley are here to tell us all about it. So I have talked to people from your place before about how you guys serve a younger population, which really makes you unique. So one of the things you're doing is group therapy. Tell me about group therapy. What is it? How does it work?
Group therapy, we see more than one person at a time working towards the same goal. So that can be cooking, crafts, or even still the exercises, so they can all work together.
So, because now it's making sense to me as you're saying it out loud, occupational therapy is doing things that we need to do in our everyday lives. So that makes sense. Maybe we do group therapy, cooking, because unfortunately we have to cook. We can't just eat out all the time, which is really unfortunate. I just want to point out, but it probably makes it, there's more camaraderie if you're doing it together. Perhaps it makes us work a little harder if we want to be doing it as good as the person next to us. And I can see where there would be a lot of things that would make group therapy work. How do you see patients responding to this?
They really enjoy it. They're responding positively just because they're able to get out of their rooms. We give them a more fun environment. So this therapy doesn't feel like work.
Yes.
It feels like fun, you know, meeting new friends, forming bonds, and then we get to see the patients also motivating each other, cheering each other on through their successes.
I love that. They're cheering for each other. So how does this improve your patient's outcome?
Really, it makes their therapy faster a lot of times because they do have the motivation. They have, you know, everybody rooting for them. It helps decrease isolation and increases their mood. It just helps move them along faster.
I definitely would see that. I mean, because that isolation, that just puts you in a bad place.
Right.
And it makes you not want to do anything. I mean, that's just like a vicious cycle.
Right.
So does it help then them not have to stay as long too?
Yes, it does. It motivates them to get home, especially with the extra things like cooking and things like that. It makes them feel like they're ready to go.
Sure.
They're ready to go and get home back to their daily lives.
Well, maybe they could cook for me too. That'd be great. So is that the only kind of therapy that you provide at Glenbook? Is the group therapy the only thing you do?
No, we also offer one-on-one individualized treatments. The group therapy occurs about 50% of the time. Then the other times we're giving them their one-on-one.
I assume you assess which therapy would be best for them and then decide which one they do. Do people do both sometimes?
Yes, we do. We offer physical, occupational, and speech therapy there. So just depending on their needs and what they need to get home, we offer all three for them.
I said at the beginning, and I've talked to Glenbook before about how you have a younger population. You actually are the only smoking facility in our area, right? Do you guys?
I believe so.
Yeah, I'm pretty sure that that's the case. And so I'm just looking at you two thinking they're so much younger than me. And that probably really correlates well to the people that you're working with.
Yeah.
You're more peers to them than if I were in there and the cranky old lady is trying to get them to do something. I'm just saying.
Right.
That really is really helpful. If somebody's interested in learning more about Glenbook and all the things you guys are doing, do they just come see you or give you a call?
They can call us, they can come and do a tour, they can look us up online, any way really.
It's all that simple. Well, you can call them at 482-4651, or you can just go to asccare.com. In the search bar, just hit Glenbook and you can find out all the information. We'll be right back.